Red Alert, Airborne Incoming, Part 2. Martin North, John Adams, Interest to People. Hello, John.
Hello, Martin. How are you going?
Yeah, pretty good. So we're back for a second discussion.
Indeed. So in our first show with Ted, Professor Steele, we got him to provide a bit of an update in terms of the scientific analysis of COVID-19, and we explored many facets in terms of what he has seen since we last interviewed him in May of 2020. Where I want to take this conversation today is to look slightly forward into 2021. So we're recording on the 7th of January, 2021. And obviously, as we said in our first show, what happens with the virus in 2021 will have a huge impact on millions of Australians and the Australian economy. And so a lot of our viewers would be very interested to have a bit of a feel as to where we think the virus, but also the response to the virus, lockdowns, etc., may go. And that's basically where I'd like to take the conversation. But one aspect before we just get there is, in one of our last shows with Professor Steele, we talked about how there were situations of ships leaving docks COVID-19 free, and then all of a sudden getting infected with COVID-19 when they had no contact with any individual. Now, one of the aspects that we didn't cover in our last show, which I'd like to just spend a couple of minutes with Professor Steele on, is isolated islands, because the same phenomena has happened with isolated islands, and Professor Steele has done some work on that. So Professor Steele, welcome back. And on this particular point about isolated islands, basically a very similar sort of circumstance where there is no contact with the outside world. All of a sudden they get in a huge explosion of COVID-19 cases. And the question is, well, if it's supposed to be driven by human-to-human transmission, how are some of these isolated islands getting infected?
Yes, good. Thanks for having me back. Let me just say this, that many of these isolated islands may very well have, contact with the outside world. It's just the nature of what happens with them. The classic one that came up, particularly in a discussion with senior epidemiologists, was, well, what about Taiwan? If the stuff's coming in clouds, fragmented clouds, why does it pick and choose? Well, it doesn't really pick and choose. It's the prevailing weather in those areas that determine whether it's going to hit the islands or not. But Taiwan has hardly had any cases, had a few little blips, but it's basically flatlined. Sri Lanka was like that too. For 6 or 7 months, it flatlined, hardly any blips. Even though it was in communication with the outside world, it certainly didn't go through any epidemic. Then suddenly on October the 6th, it went from hardly any to over 1,000 cases in 24 hours. It was explosive advent. Now, that didn't happen in Taiwan. But then you might say, well, are they peculiar places? Well, no, Taiwan is like Fiji. Taiwan is like Fiji, is like New Caledonia. They're also being free, but Cyprus wasn't. Cyprus flatlined for a long time and then suddenly became engaged with a COVID. Then the French Polynesian islands were flatlined all year, and then all the islands became engaged over the period of a number of weeks. So and then there's a small island of Aruba in the Caribbean that literally flatlined throughout the entire year, and then suddenly erupted with COVID. Now, this is how I interpret that. Ships at sea, they're almost certainly all going to get struck if they're at sea long enough, because they're going to they're actually going to move through the viral clouds or the sea spray that's been contaminated just by their sheer movement. They will, just like birds flying, catching the flu, they will fly through the clouds or sail through the clouds. So they're inevitably going to get struck. But an island's stationary. It's like a stationary ship at sea, and it's at the vagaries of the prevailing winds and weather. So that's how you explain these crazy outbreaks. And furthermore, the case of Taiwan is still interesting, because as of last night, it still only has a little blip. So it's, for whatever reason, the winds or whatever is bringing the clouds down in the other islands it's not happening in Taiwan. But Taiwan has been put up as a poster boy or poster girl as a country that knows how to handle the epidemic. They've just been dead lucky, just like Tasmania. Tasmania's dead lucky too.
Sure. All right. Now, I mean, I mean, I do want to move the conversation on, but one point just to sort of make for our audience is that for those who are looking at Professor Steele's thesis about where the asteroid come from, I guess one of the scientific questions is, for example, with Sri Lanka, how do you have a island country that is basically COVID-19 free or has very little cases for 6 months, and then all of a sudden within 24 hours you have 1,000 cases just come out of nowhere? I mean, it'd be very hard to pin that down to human to human transmission.
Oh yes, possible.
Yeah. Now, in terms of, so in our last conversation, Professor Steele, we went through a couple of countries and we showed some evidence of second waves and third waves. And I do want to come back to South Africa and to Brazil. And we'll get Martin to put those two slides up on the screen for our audience to see.
Yes.
So, but basically, in South America, in Africa, we can see clear, clear phenomena of a huge spike, and then the number of cases going down, and then it spikes up again. And so I guess the question there is that what do you, before we get on to the northern hemisphere, what sort of can you tell us about what's happening in the southern hemisphere in early 2021, and what do you think is likely to happen as we go forward over the next few months in the context of this second wave?
Well, it's clear to me that it's been in the southern hemisphere now. It fragmented from the northern hemisphere clouds in about May last year, came into Brazil, then it got caught up in the prevailing winds in the Atlantic and South Atlantic, and then it took out South Africa, which is a small country, by the way, but a dense population. So it's on the same 40-degree south latitude band as Australia. And then shortly afterwards, of course, and now there's been this long delay where we've got it's now coming up again in South Africa, but it's coming at a much faster rate. That, to me, I interpret that exponential rise, where the slope is at least double the first wave, as an increase. The dose, for whatever reason, is a higher dose landing in South Africa now. The trouble is it's still going up. The curve you've given me is cut off a few days ago, but I looked at it last night and it's still going up. And so the harbinger for Australia is that what happens in South Africa with the winds in the Indian Ocean and the roaring 40s line, it could happen in Australia. And I'm absolutely certain that Australia got hit by some of these waves in June last year. That struck Victoria. We'll talk about that later. But that could easily happen again. And I actually think, in a small way, some of these smaller clouds have already struck Sydney, northern beaches and suburbs and Wollongong, and the eastern side of Port Phillip Bay has also taken a hit, but it's nothing of the size we had earlier. But nevertheless, the signature of all those cases, you want me to predict what's going to happen this year? I think it's happening now. The signature of all these cases in New South Wales and Victoria is they come suddenly. The big question marks are written over all the faces of the chief medical officers as they report them. They said that they're all mysteries, and they're widely dispersed. That is, they're not just in one place, but they're clusters in singletons, doublets, or clusters, and dispersed. Big radii. In Melbourne, it's probably a 20-kilometre diameter, and in the Sydney, well, it's the Sydney Basin. It's Avalon Beach, it's Blue Mountains, it's Croydon, it's Wollongong. So. What's that? That's about 100 kilometres. So so that's the signature of an infall to me. And each one of those mystery cases are of great interest to me. They would have very interesting features in their genomic sequences.
Sure. Yeah, I mean,
they're genuine mysteries. Okay.
Sure.
That's my answer. It's happening now, but I don't know the extent of it. How big it's going to be.
Okay, Ted. One thing I just want to clarify for the audience, just so we can provide some context, is so when we looked at what happened in the southern hemisphere in 2020, once it started going through the northern hemisphere, we started to see, for example, Brazil explode. Yes. And then it went across into certain countries in Africa, and then it came across the Indian Ocean to Australia. So by virtue of the pattern of 2020, given that we're seeing a second wave go through Brazil, we're now seeing South Africa explode. We can if 2020 was to replicate in 2021 we would see in the next few months some sort of explosion in cases. I know that we have a small explosion, but it could be more severe if whatever's happening in South Africa comes across the ocean and hits Australia. Is that fair to surmise?
That's a very reasonable inference, because that's the same inference every year. When the flu and cold season in the Northern Hemisphere inevitably comes to Australia in our flu and cold season later. It seems to happen first there before it gets to us. So it's perfectly reasonable that we should expect it. I just hope that they're not of the same size as Victoria. By the way, the infalls in Victoria in June, July, they were on a very small scale compared with the Northern Hemisphere. You know, Northern Hemisphere is 100 to 1,000-fold higher in every way, in cases, intensity, in every way, and in region, over the region. So, given the risk, my main concern is the destructive social and economic effects of government policy. That's my main concern with this virus, because that's where all the destruction's occurring. It's certainly not happening with the virus. Elderly, immune defenceless, vulnerable people have to be looked after. That's absolutely crystal clear, and they're vulnerable to this. But 99.99% of the population is not harmed lethally by this virus. So the risk is small, and the reaction is massively overreaction. So obviously you understand that. But yes, what happens in South Africa and Brazil could mean it's going to happen again in Australia. I just don't know. I just don't know the full extent and when. But I think it's starting now.
Sure. Okay. So that's in the context in terms of a second wave. Now let's shift our focus to the Northern Hemisphere, and we've got some graphs that Martin's going to put up. So we've got Japan, South Korea, the United Kingdom, and the United States. So we're seeing in the data that there's actually a third wave, a third explosion in terms of the number of cases. So I guess. So again, based on what we have seen in 2020 in the first wave and what we've seen in this second wave is it starts to go across from Asia through to the Middle East, Europe, North America, and then it comes through South America, Africa, and then it finally comes to us. So we are seeing this explosion in the
same line again. Yeah, it seems to be the same line again. Yeah.
Sure. So in the context of this third wave into the Northern Hemisphere, one of the things I find alarming is, for example, Japan and the United Kingdom in particular, this third wave explosion in cases seems more violent than the first two waves.
Well,
so I mean, obviously, I'd like for you to sort of articulate what do you think is happening in the Northern Hemisphere, and also in terms of the time frame, if the second wave is likely to hit in the next few months, how long, if a third wave was to come through the Southern Hemisphere, I mean, would a fair estimation be August, September for this third wave to potentially come and hit Australia if it was to hit?
I can't predict exactly when, because I usually can only understand them after they've hit. But we could certainly, going on past events, it could come here again, and it may very well come in the same time frame, like June. It may be June, because that's when I'm certain the rain brought the clouds down last year for Victoria. But that doesn't mean to say lightning's going to strike in the same place twice again, except prevailing winds tend to be just that. They tend to have a rhythm and a seasonality about them. So just on those grounds, the same targets could get hit again. But getting back to the United States, getting these third waves, Japan, yes, it's serious in Japan, but it's nothing like the numbers in the United Kingdom or United States, where the United States and the UK are just going through the roof. Now, I can't understand the UK, but then again, I've a lot of things that I can't understand about the UK. What I do know about the UK is a lot of information is not being released. There's it's like a black box. It's almost like it's a partner of, China's a black box. I just don't know what's going on in China. I mean, I can't access any data. But the UK is really tough on the data. They're not publicly releasing any of their genomes, say to GenBank. A consortium's looking after that. So when they mention all these strains of mutants, it's all gobbledygook to me. I can't go in and verify it or check it out. The second thing is the the hysteria there now, and what's going on, particularly in London, and talking to Chandra Wickramasinghe, which we consult most nights on this for obvious reasons. There's an information blackout in the UK. We don't, in Victoria it was bad, but at least we had the newspapers reporting, the latest nursing home that got caught up in the epidemic, and so we had those repeatedly. We had many, many documented cases of immune, defenceless, elderly people all getting the disease and many eventually dying. In the UK, we don't have any of that granular information, apparently, in the media there. It's just blanket officialdom issuing dictums and hysterical headlines. So I don't know what to make of it. But let's just say that the UK, writ larger, is an example of what happened in Victoria. That the most of the really serious damage was in clusters of people, whatever the community, whether it was a tower where 3 generations are living together in all these small apartments, or whether it was an elderly community, retirement community, or whether it was a nursing home or an aged care facility. That sort of granular detail is actually important to understand this. This is what I think's going on. This is what my instinct says. That you're getting capricious amplification of one of these haplotype variants, right, that are trying to adjust to that community and just gets into that vulnerable, immune defenceless community. And then it literally spreads like wildfire, and the virus effectively gets cloned. It gets cloned in all these people because there are no deaminase mutators trying to mutate it. So it literally just gets amplified. And then it gets spread to the carers, and the medical staff then spread it on further. So look, I think that's going on in the UK. And that's where I think all the hysteria is. It's the same sort of hysteria as we had in Victoria when all of the nursing homes were going up. So that's all I can say about it. I just lack all the information, but I think my scenario is reasonable. It's not unreasonable. It fits the behaviour of the virus.
Sure. Okay. So one of the key questions, Ted, is that the data that we can download in terms of from the Johns Hopkins database is saying that this third wave is more violent in terms of the number of cases because of the lack of transparency that we're seeing out of the UK. Do you think that the data is accurate, that this third wave is actually more violent in terms of cases, or do you think this is being manipulated or amplified? Because the reason why I ask this is that obviously if a third wave from the Northern Hemisphere is going to come through the Southern Hemisphere, and if we are to trust the Northern Hemisphere data, which says that this third wave is the most violent to date, could we see, starting from June through to September, October and 2021, could the harshest element of the virus be yet to come?
Look, I honestly can't comment on it because we lack a lot of information. I'll just simply say that I've decided to shut my mind to what's coming out of the UK. I just don't believe a lot of the stuff coming out of there. Given my experience analysing the sequences and analysing this epidemic here in Victoria, I see lots of similarities, and therefore I can't reach those conclusions I've just told you about. But I honestly don't know, John. I don't know what we can expect.
One of the things that we are seeing in terms of the UK is potential allegations of mutations, new strains in the COVID-19, and then obviously there are questions as to if there is a mutation, if there is a new strain, what does that mean from a molecular point of view in terms of its lethality? Have you seen any evidence of new mutations or strains coming through in the Northern Hemisphere?
I analysed the epidemic in Florida that went from June, July, August, similar time to Victoria, actually. And nothing surprised me there in my haplotype analysis. Okay, the haplotype analysis, one of the variants that eventually took hold in Victoria, in the nursing homes, I presume, it had to be in them. That one of those variants, or variant-like, that was certainly in Florida, and was certainly in New York. So. But virulence means, I think this is what it probably means to the public. It's mutating, it's speeding up its speed of replication, and it's an ease of infection. Well, if it is, amongst all the healthy people in the world, it's not having that virulence impact that we would expect it to have, because the Spanish flu was really virulent. That was killing people of all age groups. That's a totally different virus. This is a coronavirus. And this is not doing that. So all I can say, I just keep coming back to the fact that its virulence, it may look virulent if it's killing very old, immune, defenceless people, but that's not my definition of virulence in the traditional way. It would be more that, normal healthy people now can succumb in a way that they wouldn't normally otherwise succumb in a potential lethal outcome. I don't think that's happening with coronavirus. No, honestly, I don't think it is.
One of the questions or one of the critiques that I've seen come through in some of the international discussions is a vaccine necessary? Because there is a body of the medical community who says, well, there are a number of available cures. They are relatively cheap to produce. If someone does get severely sick with COVID-19, there are cheap ways to deal with some of these conditions, and a vaccine is not necessary. So I guess the first question that I think a lot of our audience may want to get your views on is, do we have effective medicines or remedies for COVID-19, and is a vaccine necessary at all?
Well, the first point is I'm not a medical doctor, but I am very aware of these respiratory vulnerabilities because as an asthmatic, I've had these common colds that have almost taken me out. Okay, so I actually have personal experience of dealing with these respiratory crises. And I said it in the first program. And I think the most important thing to do for the elderly people, as well as protecting them from carers and hospital staff that might be inadvertently carrying the virus, through a mild dose of it and asymptomatic, you've got to make sure they get through the respiratory crisis. And that requires therapies. It requires hydroxychloroquine was one of them, but there's dexamethasone, there's prednisolone, there's budesonide. There's a number of anti-inflammatories that can be fashioned for the patient, I think, by their doctor for that particular patient. Then you've got to have the antibacterials to suppress the bacterial infection, which always comes with viral infections after it. It's the second wave. Viruses cause the damage, the bacteria come in. And so all those treatments, so protecting them from getting infected in the first place, and the treatments to get them through the respiratory part, they're all the really important things that have got to be done. The vaccine may or may not work on the scale they expect it to. I'm not an expert with this vaccine. I do understand the first principles behind all vaccines, obviously, as an immunologist. And I understand this too, that if you've got a stable antigenic target like, say, smallpox or polio or even human papillomavirus, where the variation is not great, you can develop a potentially protective vaccine in advance. You can show it in the lab and in field trials, and that takes years to establish. But the flu, it's pot luck. We can never predict what variant's going to come next year. I don't want to get involved in that. That's related to COVID and cosmic biology, but we'll put that aside. But with coronavirus, my experience with the haplotypes is that they should, and the mutations, which are very conserved, by the way, in all these epidemics I've been looking at, it's remarkable how conserved the coronavirus is with respect to its protein structure. Which is where the main antibodies and T cells would be, targeted against. So I think there is a haplotype range for COVID, and it can probably vary in that range, and it's probably quite stable, actually, So in theory, we should be able to make a good vaccine against COVID, in theory. But, I just don't know how that will, play out in practice. But I do know that both T cell immunity, that is, those lymphocytes that go around in the white cells that go around and kill infected cells that are already filled up with virus, it kills those cells, and antibodies, which sort of binds the virus and neutralises it so it can't infect another cell. Both those arms of immunity need to be activated, and I don't know whether these vaccines do that. And I'm just raising all of the principles. I'm not making judgment on the vaccine. But I do know that vaccines, take a long time to develop, and the efficacy, often requires, field trials. I just don't know how it's going to play out. And by then, for all we know, I know people are probably horrified, but, by the end of the year, this whole pandemic could be over and the virus gone, just like all the past pandemics in history have eventually, petered out. And why do look, before I finish, why do I say that? Well, I'm absolutely convinced from all of the epidemic data around the world that this virus has a decay time in the environment of 2 to 3 months. So when it all comes down from the troposphere, when it's all washed down, it should just decay naturally in the environment, just like SARS-1 did and just like MERS did, SARS-MERS.
Right. Okay. Yes. So there was a particular shelf life with SARS and then MERS, and obviously in terms of the Spanish flu, it was about 18 months, 2 years for it to sort of peter out as well. So it could. So basically, what you're saying is, because of your thesis on the virus, it could well be that by the second half of 2021, or if not the end, the need for a vaccine may not be required.
Possible, yeah, highly on the cards. One thing, look, just said it. One thing that Chandra Wickramasinghe and I and Reg, when this was unfolding, we were watching it happening, in China and then Wuhan, we never really understood the magnitude of the dose. But by after New York and Victoria, we could see that the dose that came in that meteorite burst had to be significant. As big as possibly the dose with the Spanish flu, for it to give us this global pandemic nature. Because the first SARS one in 2000 and 2003 was really restricted only to Southeast Asia. So that was a smaller dose. I put that down to a smaller, incoming dose. This one is much bigger. So we're looking at probably models to do with Spanish flu or radioactive traces with nuclear, stratospheric nuclear tests, or volcanic dust that gets taken up into the stratosphere, then comes back down. Both those last two events can take about 2 years. In the case of radioactivity, it might be even longer. But nevertheless, it's a couple of years what we're talking about here. Yeah.
Sure.
So this one's in that ballpark. But again, it's only an educated guess I'm giving you just on magnitude here. Yeah.
Sure. Martin, I want to sort of bring you into the conversation. So obviously with your DFA data set, you're looking at financial factors for households, you're looking at confidence, you're looking at sentiment. Obviously you and I in the last episode talked about how your view is that the virus is the main determining factor for how people will perceive the economy in 2021. So is there anything in your data set that you think is critical to know for that Professor Steele can shed some light on?
Well, I will make the point, John, that the weekly returns that I have from the confidence index show that when the announcement of the lockdowns up in the northern beaches and then the broader spread and then the issues down in Melbourne, that has had immediate negative impact on households and their level of confidence and their attitudes with regard to the spending. So there is a great sensitivity amongst many households as to what's reported with regard to the viruses and the impact on their specific behaviour, and that is in terms of where they travel, where they're going to spend, what they're going to buy, all of those things. So there is a direct correlation between the news about the virus and the economic impacts that follow, delayed, of course, because the data, the real data is always delayed, but I'm seeing it in my confidence levels immediately. So within the week after, it's moving around. That also makes the point that it varies across the country significantly. So in Western Australia, where there is much less talk about the virus and people are feeling much more confident, economic activity is booming, whereas in other states, and particularly Victoria and New South Wales, there is more concern, and that concern is amplified every time there's another announcement about it. So in a way, I'm not sure that the way that the media is reporting stuff at the moment, and I guess the way that the health departments in the States are reporting at the moment, is necessarily being that useful when it comes to actually managing the overall impacts that well.
Sure. All right, Professor Steele. So just following on from what Martin is saying, given what you've expressed in this conversation, what I'm hearing is that if Australians are planning their finances or their economic plans, holiday plans, budgets, etc., pretty much what you're saying is, you need to be extremely agile throughout 2021. Circumstances relating to public health, lockdowns, the economy, they can change very quickly, and people need to have, I guess, that financial agility and flexibility because of what you think may be happening in 2021 with the return of the virus in one form or another.
Well, first of all, comment on Martin's point that they were two little infalls, one of them the Avalon Beach, and down, and then the other one down here at the Hard Rock and Mentone Beach in Melbourne. They were all very tiny, yet the economic impact is enormous. And I think the main danger is government behaviour, politicians and hysteria in the media. They're the main dangers. I honestly, look, the virus, if we look after all our elderly, so this is my recommendation, look after make them, our elderly people, the top priority. So all aged care facilities and all clusters with aged care, anyone attending to them or looking after them has to be screened for any flu or virus. They can't be bringing that in. Then the people they have to have the facilities around them to be looked after. Their GPs, they've got to know how they've got to get them through the respiratory crisis. Okay, 99% of the people will survive it if those criteria are met. The other thing is the rest of us, the other 99.9% of the population or more, we've just got to get on with life, get on with our social life, and repair the economy. We just have to do it. So, okay, I'm a scientist who now that's putting the social things aside and becoming dictatorial about it. But if you want my recommendation, that would be it. Just let the virus go. Because nothing we do, by the way, we haven't shown you the Victorian data, nothing we do changes the course of these epidemics. The Victorian epidemic there was no impact at all by Daniel Andrews calling a stage 4 lockdown right at the height of the epidemic. As I've told you, the right-hand side of the distribution is identical to the left-hand side. It had no impact at all. It didn't shift it one iota. But look, I'm not the only one saying that. Sanjeev Sablok, you tell me, has been saying this, but also that fellow Don Luskin from the United States, who compared many, many regions around the world that went through lockdowns, he could see that had no impact at all, really, on the virus. And Rand Paul, a very, very bright senator in the United States, who's also a medical professional, he summed it up. He says this virus has had he didn't go into the cosmic origin. He said the virus has got a mind of its own. Wherever it's appeared in the world, it's just run its course, and lockdowns have had no impact on it. Now, when is that message going to get through to the politicians, that lockdowns don't work at all in any shape or form, yet they think they work? I can't understand that. I can't understand why Morrison, so forth, are not. Gladys is the only one that's got a modicum of common sense about the way we should handle this. So Berejiklian is probably the only one that's handling it more sensibly than any other politician in Australia at the moment.
Sure.
So she should be the one that's given the exemplary, accolades for how to handle it. But I'm not so sure, even she can be coerced by the hysteria of a medical fraternity and all the other power players that can see an opportunity here with all this chaos. That's what worries me. It's all of the opportunistic totalitarians that seem to have come out of the woodwork during this pandemic. It's extraordinary, the scale at which they've emerged and the way they want to control people's lives. And it looks like it's, unfortunately, it's part of the human condition. There's a sizable chunk of us that want to be totalitarians, and there's also another chunk of us that don't mind being, told what to do. So we're in a real bind, I think.
Sure, there are many people who want to do the right thing. And, when the advice coming through is do X, they will try and do X to try and be compliant, but also because it's being recommended as the right thing to do. The problem is, if the right thing to do is based on a series of premises that may not be totally accurate, or maybe despite the broader science that's there, because it fits with a particular narrative that's being constructed and put out, that's a problem. And I guess my hope would be, John, is that we get to a situation where there is more informed and open debate about what's really going on, rather than it being imposed top down on the dictatorial basis, frankly, without too much evidence. And despite people like Ted, who have a very important message, an alternative narrative, as it were, which people should be considering, because it may well change the game.
I've got a vested interest, but I know that our scientific explanation is the only coherent one that handles every level, from the molecular right through to the astrophysical. It's the only one that handles all the phenomena that we're looking at. But I don't have a crystal ball. I can't exactly predict the future, but I certainly can explain the past based on our model.
Yeah, and that's really the point, isn't it? Going back to what we said the other day, the scientific approach is you have a theory, you test a theory, you see how it flies, right? And the fact is that the test that you've done actually seems to match more closely than many other alternative narratives, and yet people are not giving your particular perspective the weights that I think they should deserve. So that's I think one of the key points. The broader point, though, is there is a political agenda here as well. And
Yes.
frankly, there are certain politicians who really quite enjoy flexing their power muscles and
question.
are doing it in terms of thinking about the election cycle and thinking how they can actually position themselves to benefit from that. And I think some of those agendas are also rather there too. And the final point is, I know that in certain areas within government, there are people who actually are afraid to express alternative views. I also know that some, social media channels are also suppressing alternative views, and indeed the mainstream media is also wanting to just plough a very narrow course. Some of us should be asking the question, why is this all happening? And I think those are some of the broader questions, John, that in the interest of the people we need to pursue.
Absolutely. Thank you, Professor Steele, for your time today.
Thank you very much again.
Martin North, John Adams, in the interest of the people. We'll see you next time.